How does a scientist like you, interested in social behavior, complex systems, model a pandemic? Like, what kind of problem is a pandemic?
So first of all, the pandemic, like any other problem, has to do with the way, like any other complex system, has to do with the way dependencies exist, right? So the 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 infection propagates through the network of people on Earth and how they're connected to each other, specifically in the mechanism of transmission, and related to how people behave and related to how people change their behavior as they're affected by the pandemic. And all of that is very clear if you think about it for a minute. But now the question is, what is the mathematics that you're going to use in order to describe this? And people who work in the field, they have to describe it using some form of a model. For example, R, the transmission rate, has to do with a model where you're assuming that the transmission rate as a number means something. I mean, the network is very heterogeneous, right? You're connected to your family and then your friends, and then there are other people over there, and people are connected in different ways. Why would a single variable have anything to do with what's happening in the behavior of the system? And the answer is that it's making an assumption about how you average the connections in the system, and only then does the variable R make sense as a way of describing what's going on. But that's an example. So now the question in a complexity frame, as I've described it, is, so what are the important variables that you need to include in describing the system? And it turns out that R, which is a super important variable, is only one of variables that you need. And in particular, there's one other one that you need can be described as the geographic spread. You can talk about it in terms of travel, how much travel there is in the system, how the inter-community transmission, which is different from the within community transmission in the system. And so if you just think about one R and not think about how the system separates into parts, then you miss a second super important variable in the system. And the third really important variable is actually the fact that the number of cases is discrete. So it's 1, 2, 3. It's not 0.001 and 0.002 and so on. And this becomes very confusing because, of course, if you have huge numbers of people and lots of infections, then it seems like the fraction of people that are sick is an important variable, but it's really the number of infections that's important. And if we don't include that, then we miss something super important, which is the possibility of elimination. Because if you don't have discrete variables, you can never get to zero. So one of the real problems that we have with many of the models that people use is that structurally in the model, they've eliminated the possibility of elimination. And so the science has decided by virtue of its assumptions that we cannot get rid of the disease. And if you listen in the news and you listen in the press, that's what they say, because there are people who are convinced that you can't get rid of the disease. We have to live with it. And why? Well, there's a lot of it out there. Is there any real scientific explanation of that? No, it's nonsense. It's only an assumption that's already been baked into many of the models that people use. So, for example, in Australia, where people achieved elimination, they did it multiple times, right? Every little outbreak they had, they got rid of it. But when they had an outbreak that had 600 cases in Victoria, a lot of the professional public health and epidemiologists said, no, you can't eliminate it. We have to live with the disease. But there was an interdisciplinary complexity science knowledgeable group that put together models that showed that, yes, you could achieve elimination. And the government believed in this model. They probed it, talked to the people, and they said, oh, maybe it'll work. And they went after it and they achieved elimination. And the key to all of this is always understanding the relevant variables. So imagine you're going to a car and you want to drive the car, right? So if you don't know what the relevant variables are, maybe you'll start turning a tire, or maybe you'll sit in the back seat, or maybe you'll open the trunk. It's fun. It goes up and down, you know. But if you know what the relevant variables are, then you know that the steering wheel, the gas and the brakes and the gear shift are the most important variables that you need to understand. And that's even before you know how they work. But if you know that those are the right variables, then you know how to control the car. You can figure it out. It makes sense. And the same thing is true about a pandemic. And the reason is that elimination becomes much, much more possible when you exert control over travel. That's obvious from what's happened in Australia and New Zealand and Thailand, and even now when we have outbreaks in Taiwan and in Thailand, the reason that it broke down, at least for now, hopefully they'll get back to getting to zero, but the reason it broke down has to do with the issue of travel control. Now, there's one more thing. I don't know if you want me to talk about it. I know that you probably want to hear about what's happening now and how we should think about this.
Maybe, not necessarily.
All right, you
I
ask me your
I was
question.
waiting for you to come to a natural stop to actually take a tiny step back because I followed you, but I think that I did not really understand, and maybe some listener too. What do you mean that the possibility of elimination is not in the model? We all hear that we want to get over the pandemic. We also hear that we will get there with immunity, like the virus will not go away. What do you mean? Can you explain that?
No, because the current narrative that's dominant is that we're going to go to endemicity. What endemicity means is that the virus is still circulating in the population. It's going to come back and it's going to come back. It never will go away because, like the flu, it's been around for. The reason is that many people study the flu, and in the flu, it doesn't go away. So the models that they use are built into them that it doesn't go away. And so the fact that there are other diseases that we've eliminated is being ignored because the people who study the flu don't study those other diseases. And by the way, it's really boring to write a paper that says, okay, the disease went away, we're done.
Can you mention one? What disease went away? When we say that a disease went away, I thought that it means that the pathogen is on Earth, but that we are all immune or vaccinated.
No, if we're immune,
little.
then it actually just dies.
Right. So what pathogens just what are extinct?
Well, polio is gone. I mean, there are many diseases that are not present in one part of the world that are present in another part of the world. Right? And the reason that that's true is that people have taken action, and the actions that they've taken have included social distancing and vaccination and all kinds of other methods of making sure that it cannot propagate. It cannot go from place to place, from person to person. And when we do that well, we pounce on, if there is a case, we pounce on it. You should read about how elimination has been done with other diseases. But the point is that if there's one case, everyone says, oh no, there's one case, and we pounce on it. We make sure that nobody gets infected by it, and we isolate people, or we vaccinate them, or we do whatever is needed. And we do it locally in the place where the people are. And so this is something that we know how to do, but people are like, oh, there's too much, or maybe it's it's a respiratory virus, so it's got to be like other respiratory viruses. No. The point is that once we understand what the relevant variables are, we know what we need to achieve elimination. And as soon as we can get cases to go down exponentially, as we've done in many parts of the world, then really we have the ability to achieve elimination. And so once people decide in their mind that they can't do something, have you ever tried to do something that you've decided that you can't do it?
Yeah. I think so.
It doesn't work very well. You don't even try. Like, I can't get that job. I'm not going to apply for it. Right? No, I'm never going to be able to climb that mountain. So I'm not going to try. So of course I'm not going to climb that mountain. So this self-fulfilling prophecy, when there are goal-oriented things that you can do, is super important. And so what's happened is that we've stopped ourselves from being able to be successful in fighting this disease. And as soon as you stop yourself from being successful at elimination, then people have these other ideas. We have to trade off between economics and the disease. So, I mean, it's all nonsense. The lower the disease, the less the economic impact, and that's been shown in many parts of the world, the easier it is to control, and you have the possibility of elimination locally and more generally. Because what you do is you eliminate it in an area, and then you eliminate it in another area. And right, we have Eastern Canada, which has eliminated the virus locally. And there's another province next door. So why don't they start carving off chunks of it and eliminating it progressively across the province? So that's the divide and conquer strategy that works. And if you think about, remember, statistics thinks about each variable. Let's move this variable. Now let's move that variable. Now let's move that variable. So if you do that and you say, okay, let's get the cases down, but you don't include the travel restrictions, then it doesn't work. You have to do things. It's like, all right, let's try the steering. Let's see what the steering does. Oh, it doesn't do very much. Now let's try the gas. What does that do? Well, I backed up and forward in the driveway. That didn't do very much, right? But now if you include the steering and the gas, and of course you have to move yourself into gear, so you need to do that too. All of a sudden you can drive. And that, what the most frustrating thing is that we have a tremendous amount of disinformation and misinformation about what we can achieve together as a society. And it was really interesting. Rory, I'm trying to remember his last name, a British politician in March of 2020. He said, why are people saying that the UK can't do what they did in South Korea? We can definitely do it. And this is a very knowledgeable, experienced politician. So why are some people saying we can't do it and some people saying we can? And the answer is there are assumptions. Remember, it's really important to have the right assumptions in order to do something that you want to do. And all I've been doing for the last year and plus is just saying, once you understand what the control variables are, you all of a sudden realize, hey, we've been going back and forth in the driveway and we've been going, doing this thing. Now just put them together and you can do it. Because we've done absolutely everything that we need in order to be successful. There's nothing that we haven't done. In the United States, in Europe, everything's been done. It's just the sequence, it's the nuance of how we put it together.